Hello, I'm Anna King, President of the National PTA, our nation's oldest and largest child advocacy association. In efforts to be inclusive of everyone who might be listening to this and who cannot see the video or are visually impaired, I'd like to share that I'm an African American woman wearing a gray suit jacket and a peach shirt. I have shoulder length brown hair and I'm wearing these amazing silver hoop earrings. I am pleased to be here with Dr. Vivek Murthy, Surgeon General of the United States. Can you imagine? He's so amazing. I can't wait for you to hear him. As a nation's doctor, Dr. Murthy's mission is to help lay the foundation for a healthier country, relying on the best scientific information available to provide clear, consistent, and equitable guidance and resources for the public. Dr. Murthy is focused on drawing attention to and working across government to address critical public health issues, including the ongoing youth mental health crisis. He also serves as a key advisor to President Biden's COVID-19 pandemic response operation. Dr. Murthy is joining us for an important conversation on the Tripledemic currently facing our country, as well as the youth mental health crisis and ways we can support students' social and emotional well-being. A couple of fun facts about Dr. Murthy. He loves the art of creating stories and telling bedtime stories with his children. He loves to create them from the beginning. And he loves mangoes. Dr. Murthy, welcome and thank you for joining us today.
Well, thank you so much, and I'm really glad to be back doing this forum together. Thanks so much for having me.
Okay, so let's start the conversation. With the flu season underway, COVID-19 is still an ever-present threat, and now RSVP hospitalizing our nation's youngest children at alarming rates. Can you explain what it is meant by the Tripledemic and why health experts are warning against these three respiratory viruses overcrowding pediatric clinics and hospitals across the country?
Well, absolutely, and I certainly understand as a parent myself of a 4- and 6-year-old why parents out there might be concerned about these viruses that are circulating. So let me put this in context. Every winter, we see respiratory viruses circulate. Those include the flu, but they also include other viruses like RSV, which is the respiratory syncytial virus. And there are others out there as well. The ones that have been in the news recently have been RSV, the flu, and of course, COVID-19. And I'll tell you about each one of them and what's happening. RSV is a virus that tends to affect kids early in life. Many kids actually will get RSV before the age of 2. But in the last couple of years, when we were taking a lot of precautions for COVID, people weren't necessarily seeing each other as much. In the very beginning of the pandemic, kids weren't in school. We saw very low levels of these viruses because people weren't in contact as much. So these viruses weren't spreading. But now as people have come back to school and become, sort of more sort of social and are engaging with one another, we are seeing these viruses come back. Now with RSV, we unfortunately don't have, a vaccine for RSV, although our hope is that that day will come soon when we do. But we do have treatments that, can be given for symptomatic care to help kids breathe if they end up having trouble. Now, most kids do okay with RSV. They're able to get through that virus, but really small kids, especially infants, sometimes run into trouble because their airways are really small. And when even just a little bit of inflammation in those airways from an infection like RSV can sometimes make them wheeze and make it harder to breathe. So the bottom line is if you have a small child who may have RSV, and if they're looking like they're having trouble breathing because they're using their abdominal muscles to breathe or straining to breathe, if they're getting fatigued, if they're not eating or drinking, that will be a time to call your doctor as soon as possible or take them to the emergency room if you're particularly worried about them. Let me just say a word about the other two viruses, flu and COVID-19. With RSV, even though that, surged early this fall, we are thankfully starting to see RSV coming down in some parts of the country. And our hope is that soon that will happen all over the country. But with influenza, the flu, there we are actually seeing numbers spike and continue to rise. And so we have to be particularly cautious with the flu. The people who are at most risk of the flu are those who are really young and those who are older. And we see when we look at, folks who are, having the worst effects of COVID, ending up in the hospital and God forbid, losing their life, they tend to be people at the opposite ends of the age spectrum. The good news is that there's a vaccine for flu. right? And if you're 6 months old or above, you're eligible for that vaccine. And the other good news is that there's a good match between the strains of flu that are circulating now and the strains that you have protection against in the vaccine. Because every year they have to make a prediction about which strains will be circulating. They make a vaccine based on that. And this year, it's a very good match. So I would just encourage everyone to go out there and get that flu shot and know that there are also treatments available, especially if you're in a high-risk group for flu. So talk to your doctor if you do, in fact, have symptoms of the flu so you can get tested and get treatment if you need it. And finally, there's COVID-19. COVID is now starting to increase in different parts of the country. We saw much lower levels over the last few months, but each winter in the last 2 years, we've seen cases rise. And that's happening now with cases and hospitalizations, unfortunately, going up as well. But the good news here, too, is that there are both vaccines and treatments available for COVID, and treatments in particular for folks who are at higher risk. And so we want people to make use of those vaccines and treatments. So if you are 2 months out from getting your last COVID shot, you are eligible for the new updated COVID vaccine. Everyone 6 months and older now has been authorized by the FDA to, in fact, receive that vaccine. So the bottom line with all of this is that get vaccinated for the flu and COVID-19. You can do that at the same time. Make sure your kids get vaccinated too. And remember that the same precautions that work to prevent the spread of other respiratory viruses will work here too. And that means staying home if you're sick, avoiding physical contact with people who may be sick, washing your hands often as well, because sometimes these viruses can spread, through respiratory secretions on your hand. And also using masks when you're in crowded indoor spaces, especially if you're at higher risk or you're around people who are at higher risk. So that's a lot, that I just shared, but those are the three viruses that you hear about in the news. And with these steps, though, getting vaccinated, reaching for treatment, and taking steps to prevent spread, we can get through this winter.
Okay, that's some great information. And I really appreciate you sharing that. Constantly washing your hands, and if you're around big groups, to make sure to wear a mask. As we look and gather with our friends and families during the holiday season, which individuals are at the greatest risk for contracting severe symptoms association with one of these viruses that you just went into detail about, and which events or activities pose as the greatest risk for exposure?
Well, the people we worry about most in terms of having severe reactions to these viruses, ending up in the hospital or even losing their life, vary depending on the virus. With flu and with RSV, we worry about really small kids, about infants in particular. And we also worry about people who are older, especially those who may have multiple medical conditions and may have weaker immune systems. With COVID, it turns out that the people who are most at risk are those who are older, so those above the age of 65. And in particular, when we look at who's being hospitalized now, it is predominantly those who are age 70 and above. And so we want to make sure that everyone has protection against flu and COVID and they're vaccinated. But in particular, we want to make sure that people in the older age groups get vaccinated for flu and COVID. And in particular, when it comes to flu, that we're paying attention to young children and making sure that they get that vaccine as well. So that's who's at risk right now. But I also just want to remind people that there are treatments available as well for the elderly who may be at higher risk if they get COVID. There are treatments available for flu as well for both the older and younger groups who may get infected. And that's really good news. And finally, with RSV, even though we don't have a quote unquote cure for RSV, there are medicines that your doctor can give you or that can be administered in a hospital that can make it easier for your child to breathe if they do have RSV. Medications like steroids and what are called bronchodilators or the same content that's often in inhalers. These medicines can be used to tide you over. And I'll just tell you personally, my daughter was sick a few weeks ago. She got a respiratory virus when she was at school. She got worse, unfortunately, over the next couple of days. And we woke up one morning and she was breathing really fast. And we could tell she was using her stomach muscles to breathe as well. And she's starting to look tired. And so we took her immediately to the emergency room. And thankfully, with the care of some wonderful nurses and doctors, she was able, with the help of steroids and the bronchodilator treatments, she was able to get over that hump. And we were able to get her home after a day in the emergency room. But so, this is very personal, I know, for me and for a lot of us who are going through this. So we want people to know that there are ways to prevent some of these viruses through the vaccines. There's certainly ways to treat, and there are also precautions we can take to keep our kids safe from getting these viruses in the first place.
Well, that is extremely scary. I worry about that all the time with my grandchildren. I can only imagine with how you felt being in that emergency room with your baby. National PTA.
One more thing I just wanted to say here is that because there's so much of the virus that's circulating, I think it is important for parents to know that even when you take all these precautions, if your child does end up contracting one of these viruses, like my child ended up having a respiratory virus, it doesn't mean that you failed as a parent. It doesn't mean that it's your fault. Sometimes despite all the precautions we take, our kids get sick, and when they're at school, we take all the precautions we can to protect them, but we know that these viruses can spread in school. So I just want to remind parents that at a time where parents have had so much more on their shoulders than they even usually do over these last couple of years, wouldn't want parents to blame themselves, for the kind of viral, storm that we're in right now. We will get through it. We just want to make sure that you reach for help and that you know all the tools that are at your disposal to keep your child safe.
Absolutely. It's important to give ourselves grace. Thank you for saying that. Dr. Murthy, National PTA has been honored to play a role in the We Can Do This campaign alongside your department. Our leaders have worked around the clock to convene school and community-based partners to increase access to vaccination and health clinics for our families. How can we continue to build on this work, and where would you recommend that we go from here?
Well, let me just say I'm so grateful for the partnership of the PTA and as a national organization and chapters across America for the incredible and invaluable work that you did these last few years to help keep families and kids safe. And I really mean it was invaluable at times where parents were confused and they weren't sure what to make of all the information that was swirling around about COVID-19. You were the trusted voices that reached out to folks and that people listened to, that brought them comfort and gave them guidance. And so I don't take that for granted. And I know that we're going to need your voices going forward, because not only are we still in the midst of COVID-19, but we also know that there are a lot of folks right now who are not using the tools that could potentially save lives, right? And we want them to know about those, particularly about vaccines. We want them to feel comfortable getting these vaccines, because they can help reduce the chances that they or their children may end up in the hospital or, God forbid, lose their lives to this virus. So in going forward, continue to have these conversations and remind parents and children, about staying up to date with their vaccines is incredibly important. Right now, there is a vaccine available for flu that we want kids and adults to take, and there's an updated vaccine for COVID-19 that we want, kids 6 months and above, as well as adults to take as well. It's our best shot at making sure that we can avoid the worst of COVID-19 this winter. And so whether it's through, electronic communication, whether it's through virtual town halls that you convene, whether it's through in-person gatherings at schools that allow parents to ask questions and have a discussion, about how to protect themselves and their families, all of these strategies will be incredibly helpful for you to continue engaging in. And finally, just because we know that many parents just want to have a chance to ask questions and talk to people about, how their kids are doing and how to protect them. And there's really nothing like having somebody that you know and trust, who's part of your community or is part of an organization that you've been affiliated with. Having someone like that who can talk to you about these issues, who understands your concern, really goes a long way to helping people get the information that they need.
Absolutely. And that's what we love about our community base, right? Our community is there, and it takes a village to help us with our children. Thank you. Thank you for sharing those strategies. Symptoms of anxiety and depression have intensified, and we know that since the COVID-19 pandemic, impacting the mental health and mental well-being of our children and young people across the country. As we approach the one-year anniversary of your department's advisory declaring youth mental health a nationwide crisis, what progress are you most proud of, and what steps can parents take if they're concerned about the mental health of their children?
Well, I think this is such an important topic, Anna, and it's the reason why last year I did issue a Surgeon General's advisory on youth mental health, because we really do have crisis that our kids are facing, and one that preceded COVID-19. It started long before the pandemic was here, but we've seen rising rates of anxiety and depression among our kids. In the 10 years prior to the pandemic, we saw a 57% increase in the suicide rate among our kids. And right now, nearly half of high school students are telling us that they feel persistently sad or hopeless. That is an extraordinary number, because we think about high school as a time where hopefully kids are looking forward to all that's going to come in their life, and they are looking optimistically at the future. But nearly half of high school students are saying that that's not how they feel. And so this is an opportunity, I believe, for us to really double down on focusing on youth mental health and doing right by our kids, because they're telling us very clearly in stories and in statistics that they are not doing well. If you're a parent out there, who's worried about your child, I think there are a few things that are important to keep in mind. One is that it's critical that we normalize conversations about mental health, and simply starting the conversation with your child about how they are doing, about their mental health, can be incredibly powerful. One, because it helps them understand that it's okay to have conversations about these, but two, it also will give them some language for how to talk about how they're feeling. I was just in Chicago yesterday, in fact, with doing some roundtables with high school students talking about mental health. And it was interesting. They often said that they're not sure if they can talk to their parents, and they often don't know what terms to use or what language to use to give voice to how they're actually feeling. So this is a place where conversations from parents can do a lot. And even if your child says nothing to you in that first conversation, it doesn't mean that it was a failure. That's the first step in opening the door to more conversation. The second thing I think that say it's important for parents is also to know what resources are available in your school. Through the American Rescue Plan, President Biden had made it a priority to put funds into schools to help with getting kids back in schools and doing so safely. And we've encouraged schools to use the billions of dollars that were allocated for them to support mental health and well-being as well. And so many schools have used this to get counselors into schools and to institute social emotional learning programs and other mental health supports. So talk to your school to understand what resources are available there as well. And third and finally, I would say one other thing you can do is just to recognize that the relationships your children have in their life, their friendships, their relationships with family members, these are vital in protecting their mental health and well-being. This is something we didn't fully appreciate as much in recent years, but the data more and more tells us that our relationships are protected. So even if we have a lot of adversity in our life, or we're dealing with a lot of stress, we have healthy relationships, if we have people that we can really be ourselves with, that we can confide in, that we can rely on for help, makes a huge difference in our likelihood of developing mental health challenges and concerns later on. It turns out, as a side note, it also makes a difference in our physical health. So anything you can do to encourage your children to build and foster those relationships, whether it's creating opportunities for them to spend time with friends and family members, or encouraging them in building those relationships on their own, is incredibly valuable. I know that sometimes doing this can be tricky with social media, and this is one of the common questions I get from parents who often say, I don't know how to manage social media for my child. Is it hurting them? Is it helping them? I'm not sure. And I sympathize with this, because it's hard to know. There's sadly not enough data that we have gotten from social media platforms and others that really helps us understand the full extent of potential harms on kids. But we hear a lot from kids that sometimes social media can make them feel worse about themselves, or it can make them feel worse about their friendships. So it's important that we understand that as part of the overall context as well, and to be able to create spaces in our children's lives where they can interact with people in person, face to face, without technology distracting them or diluting their interactions. So the bottom line is there's a lot we can do as parents. And one thing I didn't mention, which is just worth underscoring here at the end, is just the power of our example. I know that with kids, when I became a father, I had a good friend who said to me, your kids may sometimes listen to what you say, but they will more often listen to what you do. And they found that to be true, that our kids take our cues from what they see us doing more so than what they hear us saying. And so when we are able to talk openly about our mental health, and we're able to do the things that actually help support our mental health and well-being, whether it's taking breaks when we need to, investing in our relationships, seeking out help and support when we need it, that sends a message to our kids about how to live a life that supports their mental health and well-being as well.
Oh my gosh, that was great. I love that you talked about the American Rescue Plan. I got to go to a school in California that used those funds to create a wellness center inside of a school. And when you walked in, you saw two social workers, a counselor. It was so exciting. And there were so many students, and this was a high school. There were so many students inside of there just reading and getting resources. And it was wonderful that the president was able to provide these resources for our schools to create situations like this for our children. And thank you. Thank you for answering that question the way that you did. So there's another question here that I have, and we're going to continue about mental health. There's an ongoing concern about the alarming spike in self-harm and suicidal behavior among our LGBTQ plus youth. How do you suggest parents, friends, and school leaders tailor support to address the needs of our LGBTQ plus youth in crisis?
Yeah, I'm so glad you asked. And this is something that deeply concerns me too. I've had the opportunity to spend time with the groups of LGBTQ youth actually in Texas and Florida and other parts of our country just to understand what they're going through. And, we know many of them are having a really tough time. We know that rates of suicide, for example, both attempted and completed suicide are higher among LGBTQ youth. And so that means, in my mind, that we've got to put even more focus strategically on getting help and resources to those youth. And that means several things. Number one, it means ensuring that we reach out directly to LGBTQ youth and make sure that they know what resources and help is available, whether it's 988, which is the new crisis line that people can call or text if they're in crisis and if they need to talk to a trained counselor, or whether it's more local resources that we may have, or whether it's organizations like the Trevor Project, which have been really instrumental in helping provide support for LGBTQ youth. So that's one piece of what we have to do. But the second thing that we've got to do also as a country is making sure that we're continuing to invest in research and data to track how those youth are doing, to make sure that the disparity that we have right now, where LGBTQ youth are disproportionately impacted by these mental health concerns, that reduces and closes ultimately, because we need to make sure that they get more help and support. One other thing just to remember is that the environment that our kids grow up in is really important too. We want every child to grow up in an environment where they know they're accepted, they're respected, and they're valued. And that means that not only are we speaking about each other respectfully, but that we're treating each other respectfully in person and online. And what we're finding is that many young people experience bullying or discrimination, especially online. And, as a parent, that's really hard to see your child go through that. But this is a place where, again, having conversations with our children so we understand what they're going through is more important than ever.
Our children right now are definitely in need and in a crisis. And so anytime a parent can learn anything, you said the number was 988, correct? And then there's information as far as the Trevor Project as well. So thank you for adding that.
Of course.
In addition to student well-being,
Mhm.
parents and educators are deeply concerned about the academic recovery needed for our nation's students right now, and that they are primarily back in our classrooms full-time. How might school districts be encouraged to champion social emotional well-being to achieve desired student outcomes?
I'm really glad you asked. I think social emotional learning is a vital part of education. When I think about school, I think about school as being a place that prepares children for the future, that gives them a foundation for a good, healthy, and happy life. And to do that, it turns out, more than knowing how to read and write, and it requires more than a knowledge of history or of economics. It requires a knowledge about mental health and our emotions, how to recognize them, how to manage them in ourselves and in each other, and how to build relationships that are healthy. Now, we might think that is information or skills that kids should get somewhere else from the home. And I would like to think that that happens for every child at home, but the reality is it doesn't. And many parents also struggle with their own mental health and their emotional well-being. Many of them don't feel they necessarily have the skills to convey to their kids what they need to do to lead a mentally and emotionally healthy life. And so I think to incorporate social emotional learning in schools is vital. I think it's an incredibly important part of education. It's an important part of laying that foundation for a healthy life for our children. And, many schools have started doing this, especially using the funding we mentioned earlier from the American Rescue Plan, But there's also additional funding that's coming to schools through the Bipartisan Safer Communities Act, specifically to support mental health programs in schools. And I think that this is a really important opportunity to build that social emotional learning into the curricula. But one thing I want to also just highlight here is that it's important to do this in collaboration with parents and to make sure that parents understand what social emotional learning is, they understand the value it can provide, and that they offer their own advice or insights into how their child may do, with such programs. Because again, ideally, when it is a partnership between parents and between teachers and school administrators and children, that's when I think we get to our best outcomes. But this is, I think, an opportunity, this terrible COVID crisis, for us to rethink how we can do better for our kids. And part of that, I believe, is investing in social emotional learning.
I couldn't agree more. Engaging and empowering parents and guardians is extremely important. Thank you so much for joining us today, Dr. Murthy. And thank you so much for your dedication to supporting and improving the health and well-being of our nation's children and youth, and for sharing important information that will help our parents and guardians across the country. And you spoke authentically from your heart, not only as the U.S. surgeon, but you also did it as a parent. So thank you for all the work that you continue to do for our families.
Well, I
At
appreciate
PTA,
that.
well,
I
go
really
ahead.
appreciate that.
Go ahead.
And I just want to say thank you to you as well, and to everyone in the PTA who has just been such a vital part of helping us get through these last couple of years. And to parents in particular, I just want to say, parenting was never easy. It was never, a simple job. It's one of the hardest jobs, I think, that we take on in our lives. But it's been particularly tough these last couple of years. And I think we have to stick together as parents and support one another during these tough times. It's been heartening for me to see so many parents do just that. But I think it's also important for us to take care of ourselves and be kind to ourselves in this process. I know sometimes as a parent, it can feel selfish to take some time out for yourself or to attend to your needs. But our kids need us to do that now more than ever, because we need to be able to nurture ourselves, as we, if we want to really take care of our kids, as well as we want. So I just want to encourage parents to take that time to support one another, take the time you need to nurture yourselves, and know that if you ever have those moments where you feel like you're not doing everything you can or should for your child, and I have many of those moments as a parent where I feel like, I could and should be doing more. Just remember, the most important thing we can give our children is our unconditional love. When we look at this, not just through human stories, but through research and data as well, it's children who know that they have people in their life who love them, who are there for them no matter what, whose love is unconditional. Those are children who end up doing well in terms of their mental health, their physical health, their educational outcomes, and more. So just know that if you are providing that to your child, you're doing the most important thing that you can. You're giving them the most important ingredient for their health, their success, and their well-being, and that is unconditional love. So don't ever forget that. And please know that throughout all of this, you've done an incredible job to support our kids, and we're going to need you in the future.
Absolutely. And what a wonderful way to round this up and closing this discussion. Grace. And as you said a little while earlier, they watch what we do. So when we show ourselves grace, our children will do the same thing in return. So thank you for that, sharing that with us, Dr. Murthy. At PTA, we too remain committed to making a difference for the education, health, safety, and well-being of every child and youth across this country, and ensuring that every child reaches their fullest potential. We also remain committed to supporting critical school and family needs and sharing important information as you've gotten today, resources and expertise to ensure that our families and schools have the best tools to support every student's learning, development, and success. Please continue to follow National PTA and the U.S. Department of Health and Human Services for more information and resources to support your family and school. I encourage everyone to visit pta.org/healthyminds for resources to help you make mental health an everyday priority, not only for your family, but for you as well. Grace is so important with ourselves. Our children are watching us. Thank you again for joining us. And thank you again, Dr. Murthy, for joining us for this important discussion.
Thanks so much, Anna. Good to be with you again.